Thank you so much for joining us today. And just another reminder, after the presentation, either this afternoon or tomorrow, you will be receiving a follow-up email that will have the slides as well as some resources and a reminder for the evaluation. So be on the lookout for that. It will be coming from our email. So, just pay attention and be on the lookout for that. So thank you for joining Health Home Care Coordination Workshop that Amy and I do this presentation on an annual basis. I am Christy Moscato. I am the Community Relations Manager for the West and part of the Southern Tier. I cover the 8 Western New York counties, and Amy Albanese is on here also. She's the Senior Manager of Community and Provider Relations. She covers the Eastern counties as well as part of the Southern Tier. She covers 10 of our counties. So we're really happy to be here with you today. At Person-Centered Services, we start all presentations or meetings with our mission, vision, and core values. Our mission is we connect people to the care, support, and opportunities that maximize their quality of life. We're a vision, we're a community where all people lead fulfilling lives, and our core values of people, integrity, and trust. This map just gives you a nice visual of where we're located. We cover, we're in 18 counties, and we work with over 18,000 people with intellectual and developmental disabilities throughout those 18 counties, providing health home care coordination, reaching throughout the Western New York, Finger Lakes, and Southern Tier region. So why choose Person-Centered Services? What sets us aside? We have an amazing member relations department, and they do a member empowerment series. I know they have a presentation coming up soon about guardianship, about 17A guardianship. I will include that flyer in the follow-up email as well. They also have a member and provider portal. So members can, I'm going to get into that in a minute, but there's a provider portal as well as a member portal. We also are have a knowledge center where there's information about intellectual and developmental disability supports and services throughout New York State. And we also have an amazing emergency preparedness webpage, and that, winter's coming, even if we don't want to believe it. So that's really a great resource for you and for you to share with those that, you work with or that you support in your districts if you're a school personnel. So we'll talk about the member portal just real briefly, because we do have a lot of content to get through. So our member portal is great for our members. The people that we serve, we consider them our members. So, families and members can access documents. There's secure messaging that can go through there. They can upload any documents that they may need to do. They can view, download, and print their life plans. And then they can electronically sign life plans through the portal, which is a really nice tool. So a little bit more about member relations. We have a web page dedicated to them. If you scan that QR code, it will take you right to it. We have a care coordination orientation video, which is really great for new people that we're supporting. And there's also a care coordination handbook that can be downloaded and printed right from that web page. So, please take a look at it and feel free to share it with any families that you support who receive services from us. Now, community relations, mine and Amy's role. What can we do for you and how can we help you? We can do case consultations. If you're working, with a particular family or student and, you just have some questions if they would be an appropriate person to refer, you can give us a call or shoot us an email and we can set up a time to talk to you to discuss it. We do parent and caregiver workshops. We do them in person as well. We do a referral process training for staff. We just recently did one a couple of weeks ago, and that is actually up on our YouTube page. We have information folders that have, our intake packet and some general information for families. And then we can also table at different community events, open houses, and resource fairs. We really try to prioritize those geared towards the IDD or special education population, but we attend whenever possible. So let's talk care coordination. What is a health home? First, let's talk about what it is not. It is not a physical place. Um, the main role of a health home is to link to community supports and services, and then to coordinate those resources, really integrating the primary care with behavioral health. And, our care coordination team really is that partnership between the person, their family, and everybody on their interdisciplinary team. We want everybody to work together because it really truly does take a village to support the people that we serve. And what does a care coordinator do? A care coordinator is that person who acts as the link between the member supported and their services. They focus on that person-centered planning, on that health promotion, transitional care, which can be transitioning, even from elementary to secondary or into adult services, or transitioning out of an inpatient stay, maybe at a mental health clinic or a hospital discharge. We really focus on the person and on making sure that the family has everything that they need as well. They also will link to community and social support services. Those social support services are crucial for our members. And then paying attention to that health information technology. So what is a life plan? I've mentioned it a couple of times. I have a 19-year-old daughter who has exited high school, and as a school age parent, I always thought of the life plan as very similar to an IEP or an individualized education program, but this is for everything outside of school. There's that assessment narrative summary as one of the sections. There's the goals section where in there is about the outcomes and support strategies that the member needs. There's the IPOP session, or the individual safeguards and individual plan of protection. There's the home and community-based services waiver, or HCBS waiver, and Medicaid state plan authorized services. That's where all the OPWDD services would be listed. And then there's all supports and services, both funded and natural and community resources, including the list of all the providers, the school they attend, the doctor they go see, the dentist, any behavioral support, etc. And just like an IEP, the document changes as the needs of the person change. It's a living, breathing legal document. So the care coordinator really works hard with the member. They do what's called a PATHS assessment in the creation of the life plan. And the life plan is created by the person with the entire team. So we want everybody's input involved in the creation of this life plan. And then in the biannual reviews of the life plan, twice a year, the life plan is reviewed. But like I said, it can be more if the need arises. Now, for the school staff that's on here, the life plan can be integrated with into the school, into the IEP. You can see this is one, I think this is for a preschool student. This just shows you the section. It can go in the My School and Learning section, what the information is, and the life plan can just be integrated right into that IEP at the school. And then we have another example for an older child, for a high school student that attends a BOCES program where they're really working on life skills and that they're going to attend until they're 21. That again will be in the My School and Learning, and it can be in the Let Me Tell You About My Day section of the life plan as well. Care coordination and school collaboration is really, really important. The care coordinator can bring a unique perspective. We want care coordinators, especially if the family would like that to happen. We want them to attend the Committee on Special Education meetings. They can help link to those community educational supports. If there's a need for educational advocacy or just somebody there to support the family and the member at those meetings. They can communicate and share any updates with that school support team. Maybe grandma passed away, or the dog, is sick, and, the school might be concerned about the behaviors that the child is showing in school. Maybe that's because of something going on at home that the child did not communicate, or the family didn't think to communicate it with the district. They can collaborate in that transition planning. Another thing we're going to include in the follow-up email is our transition checklist. That's great for families of children ages 14 and up. And, it's a good way for the school to keep their eye on things and for the family to keep their eye on things, as well as the care coordinator to be thinking about what's coming up. Because once a child turns 14, they're transition aged, that 14 on up, 14 to 21 or 22 is considered transition aged. The care coordination information can also be added to the PLEP section, the academic present levels of performance, in the transition section on the IEP. So there's a lot of great information and resources that can be shared in collaboration that can happen with the care coordinator and the school district. So now Amy's going to take over and talk about intake and enrollment.
Thank you, Christy. So the next section will be about Office for People with Developmental Disabilities, also known as OPWDD, eligibility. So there are two different buckets of eligibility. The first one is provisional eligibility. So this is a temporary eligibility status for children under the age of 8 who show potential for a developmental disability, but may have delays that could improve with services. So this allows the child to receive OPWDD supports and services while OPWDD assesses the child's long-term eligibility. And this happens around 7.5. So if the child is already enrolled and has a care coordinator, the care coordinator will support the family with applying for permanent eligibility, which is 8 on. And OPWDD will look at delays in functioning related to cognitive, adaptive, social, emotional, motor, and or language areas. And I do have a visual chart on the next slide. So the most important part of this to know is that the child does not have to have a qualifying diagnosis. OPWDD will be looking at this visual criteria. So that 25% delay in 2 functional areas, 33% delay in one of the 5 functional areas, or a 12-month delay in one of the functional areas. And then that adaptive assessment will also play a role, which we will get to shortly. So this is a really nice visual. And again, you will get this PowerPoint, and you can always reach out to Christy and I for any case consultations. But for provisional eligibility, we typically say 3 years old and up. If the child qualifies for preschool special education, there is a very high chance they will qualify for provisional eligibility. The Medicaid piece is where it gets really challenging, which I do have some slides to talk about, because the person needs eligibility and Medicaid to be able to enroll. There's a few benefits of having just eligibility that we will also get to shortly. So the next part is our permanent eligibility, which is ages 8 and up. So this is where the person would need to have a qualifying diagnosis. So here is our full list of all of the potential qualifying diagnoses. And for the neurological impairment, I believe there's over 3,000 different neurological impairments. So this is a really great one where you might want to reach out for a case consultation. Christy and I do have really great relationships with staff at OPWDD that we can reach out to if we're unsure how to answer your case consultation questions, so we can get you information directly from the source. So please reach out to us with those more complex questions. And then another visual to kind of go through the permanent eligibility. So the person would need a qualifying diagnosis. If they have an IQ under 60, we're still going to want an adaptive assessment to show where the deficits for social communication and daily living skills are. For scenario 2, if they have a diagnosis with an IQ over 60, the adaptive composite score would need to be 70 or under. And then if the composite score is over 70, 2 of the 3 subdomains would need to be under 70. So a little more information on the adaptive assessment. So typically school districts complete these during the reevaluation. There are some cases where OPWDD might just want an updated adaptive, not a full cognitive, depending on where their evaluations fall and what their historical testing looks like. So I do have some assessment slides coming up shortly. But for the adaptive assessment, this is designed to measure a person's level of independence at normal daily activities such as dressing, eating, and communication with others. The assessment should reflect not what the individual can do, but what they actually do on their own, with no prompting, reminders, adaptations, or structuring of the situation. And if the person needs reminders or picture charts, supervision, items placed in specific locations, things laid out for them, things placed in special containers, etc., then they are not independent for this assessment. So this is a really nice kind of overview of what parents would be really helpful for parents to know and teachers prior to completing. So if you are a school psychologist on here or somebody who may be having a conversation with the family prior to them completing an adaptive, we do have this information in a Word document that we'd be happy to share with you to provide to the family prior to completing the assessment. So once a family is connected with our intake department, which is a free service to help apply for eligibility, the intake specialist will work with the family and the school staff and other professionals who might be supporting the person to gather all of the documents listed here. And the social evaluation is something that the intake specialist will actually assist with completing. And then if the child is looking for provisional eligibility, they'll want those additional early intervention and therapy evaluations. So earlier I had mentioned that in order to enroll in person-centered services or any care coordination organization, the person must have OPWDD eligibility, either provisional or permanent, and Medicaid. So for children under the age of 12, we are having some challenges in intake getting approval for Medicaid for non-Medicaid families. So for intake to support the family, the person needs to meet the requirement of a reasonable indication of need for services. All other avenues must be explored and documented in the in-process life plan. The avenues that should be explored before requesting a waiver service are. So we do have some slides on what OPWDD waiver services are in the next section. So in order for a person who does not have Medicaid and between the ages of 3 and 17, they will have to work with their intake specialist to get pre-approval for an OPWDD waiver service. And they need to prove in the justification that they have explored all avenues to try to meet the need for that service. Family Support Services is actually an OPWDD grant-funded service that only eligibility is required, no Medicaid or no enrollment. So this is that service I mentioned that if a family does not have success with getting waiver and Medicaid to be able to enroll, but they have eligibility for their child, they can still access anything in the Family Support Services directory, which is on our website. And so we will, in the follow-up email, send you a link to our community resource documents webpage, which has tons of resources for everything we're talking about today, even about adaptive assessments and the Family Support Services directory for Finger Lakes and Western New York. If there's anybody on here from Region 2, which would be Cayuga County or Onondaga and out, we do have a separate directory we can email you. But anything in those directories, families do need to attempt to access first, and then the intake will justify what they've tried and the outcomes. So the Medicaid waiver approval process. So these things that I'm mentioning are OPWDD waiver services, environmental modifications, vehicle modifications, assistive technology, and family education and training. Either alone or in combination with one another is unfortunately not sufficient enough to demonstrate the individual's reasonable indication of need. So respite and or community habilitation need to be the primary waiver service approved. And then you can have the list above be supplemental and secondary services that they're seeking. So you can't just get approved for the EMODs, VMODs, ATEC, or education and training alone to get waiver and Medicaid. You can apply for those secondary, but the respite and or ComHab. So for children under the age of 12, respite is going to be the primary waiver service you're seeking, and then you can also add in those other. So they would need to prove how they don't have access to childcare. So things to be mindful of are like if they have family in the area, but they're unable to meet the high needs of their child, and that's why they aren't able to get care, things like that, or maybe they don't have family. 12 and up, we try for community habilitation as their primary, which is life skills assistance. And these services, as well as other time-limited services, are not intended to be provided on a long-term basis. So that's why you need the respite or COMPAB. We also have resources on our community resource documents webpage with Q&As about this and visual chart flow charts. So they're really helpful to kind of get the big picture about this. So going back to the OPWDD eligibility assessments. So for cognitive assessments for provisional eligibility, OPWDD has less stringent criteria where a named qualifying diagnosis doesn't need to be present yet, which we mentioned earlier, and that we already went through the criteria that they are looking at. And because children can change so quickly, for children under the age of 8, OPWDD will typically want a cognitive assessment that was completed within 12 months of the packet submission. So everything that we're referring to in this section about assessments, I know that I get, and Christy probably does as well, get a lot of questions from school districts or providers who do testing, especially school districts, that there is an assumption that the district is responsible for completing testing when we request it. And that is not the case. So we're always going to ask school for school-age children first if OPWDD requests updated testing. So we have to remember that the OPWDD is a voluntary service that families are choosing to access. So if OPWDD requests updated testing, we will most likely come to school first. If it is outside of their evaluation time, school does have the right to decline if they're unable to assist with doing updated testing. We would just need that in writing. So you can either email it to the parent if they asked, or email it to the intake specialist if they asked. It could just be a simple letterhead or email, just declining that they're unable to provide testing outside of the evaluation period, for that it just doesn't fall in line and they don't have access to that. And then the intake can work with OPWDD to either get the child assessed at their clinic if they have one in the area, or maybe looking at an outside provider. So I'm sure a lot of school staff, if you're on here, have had that scenario happen. And if you're unable to provide it, just in writing, decline it, and then we'll work with the family to figure out how to get that testing updated. And for permanent eligibility. So there are a little bit differences for maybe why OPWDD might be requesting updated testing. So if a child whose historical scores vary, or who are trying to qualify with an intellectual disability and are applying for permanent eligibility, also known as full eligibility, OPWDD will most likely ask for a cognitive assessment within 12 months. So this criteria can also help you be mindful of when it's appropriate to make a referral for a child if there's not an emergency need. For ages 8 and up whose cognitive scores are generally consistent over time, they may be able to accept a cognitive older than 12 months, but generally within 3 years. If a child has a qualifying diagnosis that is not intellectual disability, OPWDD is more flexible with how old the cognitive assessment can be, and likely will not need a cognitive assessment within 12 months if there's one within the last 3 years. So that just kind of gives you a high level overview. This is more important for school psychologists to know. So if you are with a district on here and you want to share these slides with your school psychologist, or provide them our contact and we can talk with them, we found this to be really helpful. And then for adaptive assessments, again, a child's adaptive functioning can change quickly. Their health, placement, mental health, medication, etc. So many things can alter their functioning level, resulting in the need for a current adaptive, which is why for typically children, OPWDD likes to have that adaptive within the last 12 months. And then here's just some different, just kind of thoughts that OPWDD helped me put together. So I'm not going to read through them, but recommend connecting students after their most recent testing is complete, unless they have a high need for care coordination services. But you definitely are going to encounter those one-offs, and that's what Christy and I are here for case consultations. And then just some resources that you'll have access to after the presentation if you want to look more into it. And Brianna Stewart, who leads the eligibility unit's email, if you want to reach out to her for anything. And the lead psychologist for OPWDD has her email here too. So next we'll talk about those OPWDD supports and services, which does include waiver. So for ages 3 through 17, there is an array of services they can access while school age. They could access self-direction, where they get a budget and they can hire their own respite or ComHab staff. And again, community habilitation, ComHab for short, is typically ages 12 and up. And they can also get funding for community classes and memberships and things like that. Agency supported ComHab, also again, community habilitation 12 and up is existing. Respite could be in-home, site-based, or recreation. Assistive tech, environmental mods, and vehicle mods. Remember, those supplemental along with that family education and training. And there is a small bucket of behavioral and mental health services. So something I want to mention here is the list that we have on this slide is under OPWDD supported behavioral and mental health, but having a care coordinator is so much more than OPWDD services and supports. Our care coordinators can link and refer to community providers as well. So if there is not an OPWDD service to meet that person's need, then they are going to be looking to refer to therapists and different doctors and behavioral health specialists, not through OPWDD as well. So that they're not only getting referred to OPWDD, it's so much more. So we always like to say, a person should be coming to care coordination and person-centered because they want a care coordinator, not just because they want OPWDD services and supports. And so those crisis services that exist under the OPWDD umbrella, there is CSIDD New York Start ages 6+. There's intensive behavioral supports. In-home behavior supports are actually typically family support services, where you do not need Medicaid or enrollment, you just need eligibility. And then Monroe County has a collaboration of through URMC with Community and Home Intervention CHIRP program. Article 16 clinics are typically for older students who've exited school, and then there is a partnership with Preston's Developmental Services for an array of therapies. And then here's a whole array of additional services that people can access once they exit school that can provide day programming, those life skills, or an array of different employment support. And the care coordinator helps the family as they're transitioning and the person get access to adult services as they're exiting school. So based on all that information, if you are working with somebody who you think might be eligible, how do you refer that person to person-centered services? So again, we have a really large intake department. We have 3 huge different teams, and a lot of that support is typically done virtually, but you could request in person if needed. So we really look to you professionals to support getting families to our intake department so that their first connection with us is their intake specialist. It's not the only way. So we have 3 different options we'll review quickly. We do recommend that professionals do, if they have the capacity, to pre-complete our referral forms on our website and obtain signatures from the family and submit the referral on behalf to either Christy and I or our intake department. We do have a recorded training on our website and YouTube. And Christy and I also do one-on-ones, small groups, or staff trainings on this. We do have a 2-page referral form that could be filled out and sent over. No signatures required. I would just say at least verbal consent. And then our intake will reach out to the family and help, or families can call on their own directly to our intake line. So you might have heard of OPWDD's front door. So it has changed a little bit in the last few years. So families who are connecting with us also need to connect with their local OPWDD front door office. So this is the Region 1 number. If you're on here from Region 2, reach out and I can provide you with that number. We also have a 1-page flyer that Christy can include in the follow-up email. And then there are some non-mandatory, just great resources. There's front door videos, and we have an intake orientation video that families or professionals can watch. So what to expect from us? So once the referral packet in some capacity, whether a provider's helping or the family's connecting and working with our intake team on their own, gets completed and returned, they'll be assigned an intake specialist. That intake specialist will work with the providers, the school staff, the family. It's a collaborative effort to obtain all documentation needed, submit it on behalf of that family for review. OPWDD will make a decision and they'll work through what the decision is with that intake specialist. If they are deemed eligible and need Medicaid, the intake will support with that. If they already have Medicaid, they'll move on to enrollment and be assigned a care coordinator. And then just a couple high-level resources that we like to share with people that we also can have a document sent over. We do have a really robust events calendar on our webpage that I recommend looking at. There's 2 OPWDD Facebook groups that are great for professionals and families that we can share the link with. You'll have access to that family support services directory on our webpage. There is a website called In the Driver's Seat that is directly just about self-direction, and the document we can share with you about these has links to all of the different resources. Parent to Parent of New York State is a great free resource for families and providers, and Parent Network of Western New York, if you're out towards the Buffalo area, was an amazing resource as well. And then again, we'll send that PDF over. We do have our YouTube channel that we recommend subscribing to. Anytime new videos are added, you'll get notified if you do subscribe. And then this is the link to that community resource documents webpage that I was referring to, which we will also send you the link to in our follow-up email. And then just a couple of upcoming virtual events. So to close out our fall webinar series, we are hosting a parent workshop that we highly recommend you sharing with your families for school-age students 5 to 22. And that's on the 28th at 6 p.m. and we will record this. And then we have our next engagement series session on bullying and youth with special needs on November 18th. And then every January, Christy and I host a transition services virtual expo. We are doing just one night only. It's from 5:30 to 8 p.m. January 28th on Zoom, and this covers all counties. We will have local service providers from all our regions on in breakout rooms that families of transition age youth ages 14 to 22 who have special ed services can come and connect with providers. And then to close us out, here is our contact information in the counties that we support. So feel free to jot this down, but it will also be provided to you in the follow-up email tomorrow. And then we do greatly appreciate any feedback. This really helps Christy and I plan for our future and different presentations and just kind of continue to improve our presentation skills and content. We will also send you the link to the survey as well. So if you do have your phone on you and you have a second to scan the QR code and you want to take 2 to 3 minutes to fill out that survey, we would really appreciate it. And then lastly, we really encourage everybody to check out our social media. We share great news all the time, really important updates, just good things going on in the community where we are going to be if you want to come meet us. You can find us on any of our social media platforms. And we will close it out with a live Q&A. So feel free to enter your questions into the Q&A box or chat box, and we will have a quick dialogue.
I allowed everybody to unmute. I don't see any questions in the Q&A or the chat yet, but if you have a question, feel free to unmute and ask your question, or you can type it in the Q&A or the chat box. And again, like Amy said, we really, really appreciate you spending a little time with us this afternoon, to learn more about health home care coordination and OPWDD, eligibility, services, and supports. We just still have just a couple of you on here. If you don't have any questions, enjoy the rest of your day. I don't know if it's raining near you, but it's storming near me right now.